our esteemed guests, Fraser Reilly-King from the Canadian Council of International Cooperation, otherwise known as the CCIC, Sandeep Prasad from Action Canada for Population and Development and the High-Level Task Force for the International Conference on Population and Development, and Melissa Ditmore, consultant for ICASO and member of the Civil Society Working Group on HIV and the Post-2015 Development Agenda. So today's webinar focuses on the Post-2015 Development Framework, which, as we know, is to succeed the 8 Millennium Development Goals that were brought into being in 2000. As we know, these MDGs range from having extreme poverty rates to stopping or halting the spread of HIV to providing universal primary education. And the MDGs have really provided an important blueprint for the world and for all the countries who have signed on in shaping their development efforts, both at the national level and at the global level. And while there has been some criticism that's accompanied the MDGs, and there has been unequal progress in attaining the goals across countries, the MDGs have really been pivotal because of their instrumental role in galvanizing unprecedented efforts around the world to meet the needs of the world's poorest at the national and the global level. So today, on November the 10th, we are basically on the eve of the conclusion of the Millennium Development Goals. Over the last 2 years, the world has been ramping up for the introduction of a new framework to guide global development efforts, which is what we know as the Post-2015 Development Agenda. So for folks, those of us who have been following this or have heard whispers of what's been going on in New York and the consultations around the world, we know that the design process has been very inclusive, has been very long, has been very complicated and complex, and a titch convoluted. So in terms of today's objectives for our session, what we'd like to do is really to help connect the dots and to clarify and provide an overview of the process this far, and to look at how sexual and reproductive health rights, how gender issues, how HIV fits into this new global blueprint. And then finally, to identify key opportunities for engagement during these final months before the post-2015 agenda is ratified. And I welcome everyone who's just joined. We're just starting the introduction. In terms of housekeeping and process, a few housekeeping items before we begin. Today on our webinar, we are using teleconference as well as the webinar platform. So we ask everyone to please use the *6 function now to mute your lines. And then during the question and answer period, you will have the option either to voice your questions using, again, the *6 function to unmute your line, or else you can use the chat box, which is located in the lower right-hand corner of your screen. We also, on the top toolbar panel at the top of your screen, you will see a little figure, a little person, and that is the raising hand button. If you would like to raise your hand to make an intervention or raise a question, please do so, and we will be able to call on you in queue. And then just to keep things really interesting and exciting, we have a couple of fun interactive polls that we will put up on the screen throughout the course of this webinar. And we kindly ask you to delve into those and share your thoughts. So in terms of process forward, I'm going to spend a few minutes to introduce our 3 featured speakers, at which point each of our featured speakers will have about 10 to 12 minutes to share their talk with us. And then we will open up the floor to questions and answers. All right, are there any questions at this point before I move into introducing our speakers? All right. So it is with great pleasure that I introduce Fraser Reilly-King, who is the Policy Analyst on Aid and International Cooperation for the Canadian Council for International Cooperation, CCIC, which is an umbrella organization in Canada for not-for-profit organizations engaged in international development work. Fraser sits on the Management Committee of the Reality of Aid Network as the Vice Chair, and he is the North American representative to the CSO Partnership for development effectiveness. Prior to joining CCIC, Fraser worked at the Halifax Initiative Coalition, the HI, and the Canadian Presence for Public Interest Research, Advocacy, and Education on International Financial Institutions and Export Credit Agencies. In a volunteer capacity, he has sat on the boards of the Canary Research Institute on Mining, Environment and Health, and UNIFEM Canada. Welcome, Fraser.
Thank you.
We have Sandeep Prasad, who is an Ottawa-based lawyer and activist who has worked since January 2011 as the Executive Director of Action Canada for Population and Development, otherwise known as ACPD, which is a human rights organization working within Canada and internationally on issues of reproductive and sexual rights and health. Since September 2012, Sandeep has served as a member of the high-level task force for the International Conference on Population and Development, which aims to galvanize political support for sexual and reproductive health and rights and ensure that international development efforts prioritize these issues, including within the post-2015 development frameworks. And we have Melissa Ditmore, who is an advocacy advisor for ICASO, the International Council of AIDS Service Organizations, who is working on the post-2015 International Development Agenda. Melissa's experience focuses on key populations and evidence-based proven effective strategies for HIV prevention, treatment, and care. Melissa has worked with sex workers, transgender people, and people who use drugs in Asia and Africa and the Caribbean. So welcome to our speakers. And at this point, I'd like to welcome Fraser and hand it over to him, at which point we will also hear then from Sandeep and from Melissa. Thanks, Fraser. Over to you.
Hey, great. Thank you very much. I'm going to basically set the backdrop, I think, for what Melissa and Sandeep are going to talk about in a little bit more detail, the health aspects and HIV/AIDS aspects. But we thought it would be useful to give people listening a bit of a sense of where the process is at, how to engage in it as well as Canadian or even international organizations. As Robin mentioned, it's just 10 minutes, so it's going to be quite brief, but I would also refer you to, I think, a backgrounder that was circulated that gives a lot more detail and texture to the whole process, as well as Canadian government positions. So firstly, as mentioned, I'll give you a sense of the process to date and where we're at, give you a snippet of information on Canada's priorities and positions, in particular as it relates to health issues, and then talk about how CSOs can engage in the process. So I'm assuming everyone can see the slides as I move along with them. If you don't, we're now on the post-2015 process, so I guess just send a text to ICAD if you're having trouble with these. So essentially, if you look back a few years, there's two processes that have come together over the past 2 or 3 years, what I call two streams. One that has focused essentially a little bit more on environmental components, in particular a follow-up to the Rio conference. The UN Conference on Environment and Development took place over 20 years ago in 1992, and in 2012 they had a Rio +10, a review conference on the outcomes of what had happened from Rio, the whole Agenda 21 agenda. And one of the outcomes of that, beyond the outcome document itself, was the process tasked a group called the Open Working Group to come up with a set of sustainable development goals. So this is something that the Open Working Group has been doing since 2012. They just completed their work prior to the summer in July of this year. It was a group of essentially what they call troikas, 30 different troikas, bringing together a collection of 2 to 3 governments involving up to 70 different governments who negotiated between themselves, also with input from major working groups like the Women's Group and the NGO Group, with input, a set of sustainable development goals, 17 goals and 169 indicators, and I think Sandeep and Melissa will be referring back to those. But that was a really key piece of work. Beyond the goals, we also need to think about how we finance them. And so there was also an intergovernmental committee of experts on sustainable development financing that was set up to think through the dimensions of how they might go about financing. And this will be a key input for later. But both of those documents were submitted to the UN General Assembly in early September and act really as defining documents for the process looking forward. There are other elements to that, but those are the sort of bare minimum. There's also, parallel to this, there's been a whole post-2015 process. So the UN System Task Team, which brings together all of the UN entities that work on issues globally, pulled together a task team, produced 2 or 3 reports that laid out their perspectives as UN agencies on what this framework should look like. So they started to talk about the importance of including dimensions related to the environment, to social and economic development, and to peace and security, and really putting human rights, gender equality, all of those key dimensions, equality, inequality, at the core of that agenda. So they were very involved in developing the sort of UN perspective on things, but they were also tasked with doing a whole host of thematic and national consultations. There's been over 100 national consultations, and I think 12 thematic consultations that have taken place that have pulled together the perspectives of different individuals living in different countries and on different issues, including health, education, employment, etc., to feed into the process. One of the big critiques of the the Millennium Development Goals is that a lot of governments and civil society felt that these were developed very exclusively, without any consultation. And so the UN System Task Team has led a process to have much more consultation and input towards the final framework. Beyond that, many of you, I'm sure, have also heard at the high-level panel of eminent persons on the post-2015 development agenda. This brought together 20-plus individuals from around the world who provided, again, one of the sort of key inputs to this framework. In May 2013, they produced their report, and it started to lay the groundwork for, I think, some of the thinking that has continued in the process. So, for example, that we can leave no one behind. It's not just about cutting poverty in half or reducing hunger, but it's about leaving no one behind. It's about ensuring that sustainable development is integrated deeply within any future set of goals, of seeing how we can make the most of growth and ensuring that it's inclusive growth, of ensuring that we have peace and security in the world. And to achieve all of that, we need a data revolution. So a way of measuring all of this, monitoring progress, etc. Those are some of the key dimensions of what they brought to the conversation. So they talked about 0 goals, not leaving anyone behind. There's also been, parallel to that, there's been a set of different working groups and task forces looking at issues related to monitoring and indicators, data, accountability. So they're getting input from all over the place on the range of issues of what we need to have for a post-2015 framework to work. So it's not just about the goals, but it's also about a monitoring framework, about the indicators for measuring things, about ensuring that there's input from different groups looking forward, about ensuring that we have the capacity of governments to do all of it. So those were 2 streams that were essentially running in parallel. In September 2013, at a special session on the post-2015 process, governments decided that these 2 streams needed to be brought together, that you shouldn't be having 2 different sets of sustainable development goals and whatever would replace the Millennium Development Goals, that those should be one thing. That these were universal goals, that they didn't just apply to developing countries, but they applied to countries all over the world, including Canada. They identified that the work of the Open Working Group and the Intergovernmental Committee of Experts would provide key inputs to the process. So those reports were submitted last September. that the Secretary General would provide a synthesis report that pulls together all of these different elements that I talked about. That's now expected to come out in mid-December. That there would be intergovernmental negotiations to set the next agenda, the successor to both the Millennium Declaration and the MDGs, and that once they had negotiated things, they would meet at the level of heads of state. So this really merged all of these ideas together into environment and development finally coming together after 20 years. So looking forward, I've laid out a few key dates. Really, the discussions have begun on what different governments feel about the post-2015 framework, about the open working group document, about what their key priorities are. That happened at the opening of the General Assembly in September. They're still negotiating the modalities for the intergovernmental negotiations. So, for example, for the Heads of State Summit, there's a set of modalities. For the intergovernmental negotiations that will lead up to that summit, there's a set of modalities. So we've agreed on the Heads of State Summit. We know the dates. It's, I think, 28th to 30th. But we don't yet know the process for the actual negotiations and the extent to which civil society will be able to feed into those. As mentioned, the UN Secretary General's report will be a key input. There is some debate about how governments will take that, and we can maybe get into that in the discussion period. We're still waiting on Canadian consultations. At an earlier point, they said that they would like to link that to the Secretary General synthesis report, but who knows? It's possible that there may never be consultations, but we're still hoping. And then best case scenario, the negotiations will begin in January and run through presumably until end of August, where they'll have a final outcome document. But a key moment during those negotiations will be in July, where there's the third Financing for Development Conference. You may remember Monterey in 2002, the first Financing for Development Conference. There was a review in Doha, Qatar in 2008, and this will be the third one in Addis in 2015 in July. And that will be key because I think that will basically set the level of ambition for the framework. If governments aren't making solid commitments on how they go about financing this framework, then I don't think we can expect a very ambitious framework. And then finally in September, governments will meet at the head of state level in New York. So very quickly, just on Canadian positions and priorities, Canada does have a whole host of different positions on different issues, but really the top three, perhaps not surprisingly, are around maternal, newborn, and child health. They want this as a standalone goal. There's big concerns from Canada that MNCH, as part of a broader goal on health, will get left behind, just as there's been increased focus on trying to reduce what were goals, I guess, 4, 5, 6. There's strong interest as well linked to that in trying to establish basic vital statistics for all countries, so measuring deaths and live births, among other things. Perhaps also not surprisingly, Canada's interested in what it felt was one of the missing agendas of the MDGs, which was growth and job creation, that we can't achieve these goals without growth and without job creation. We have some critiques of Canada's approach, which I can also maybe get into in the question period. And then finally, and this links to part A, a focus on results and accountability. So Canada wants a limited set of goals. They want to be able to demonstrate concrete results and outcomes from these, and they want to be able to have a set of clear indicators for measuring them. So Canada is leaning on the work it did around the whole Accountability Commission within the UN on maternal, newborn, and child health, some of the work it's done through the G8 on accountability, and I think they want that to be a key component of that. So they're also involved in a working group with Peru, UNICEF, and others. Stats Canada is involved. So they're really thinking through the data dimensions of all of this. So there are a number of points which I can come back to on the different positions, but I'm probably running out of time. But you'll have that in the slide to look back at. So just finally on the opportunities for engagement, we've had very good conversations with people at DFAT-D. They're very open to discussing this. They've set up a task force, as you can see from this image, that to a large extent mirrors the process of the open working group. They're engaging around a range of different issues. There's key point people that you can see there. In our latest backgrounder, we have an updated version of this. And they're really encouraging groups who have technical expertise on these issues to meet with these point people and make recommendations on what you think, for example, would be the key indicators and targets on health-related issues. So there's an opportunity there regardless of whether the consultations happen. Canada has been involved in supporting consultations on education and now on accountability. They have recently held a series of roundtables on MNCH. As mentioned earlier, there's no concrete plans on specific consultations with Canadians, but there's likely, if it does happen, to be at least an online consultation to allow for input from as many groups as possible. But there may also be an in-person consultation. So again, if you want to feed into this process, here's another opportunity for you. Finally, maybe just to talk very rapidly about Canadian plans. We're hoping to launch a campaign in the new year linked to post-2015 with a focus on a few of the key thematic issues. Other groups like Engineers Without Borders are going to be doing something similar. In fact, I think there's a whole host of groups who are planning things, especially in the lead up to the election. So we're hoping to see if we can play a role to at least pull together those groups and have a bit more of a coherent message to the public and to Canadian political leaders on that. And then, so, you know, all of that to say that you're more than welcome to engage in any of that. And then finally, just if you want to engage at the international level, Beyond 2015 is a global campaign, probably one of a few, that's engaging around this process, very actively involved. CCIC is the Canadian hub for Beyond 2015, and they're always looking for inputs from groups on the range of things that they're developing. And as mentioned, there's still a whole host of UN activities going on, so depending on how you want to engage, I can probably help steer you in the right direction if you want to provide inputs on that. So I think that's it for me. Oh, maybe just, sorry, on the last point to say, 2015 is a big year, not just on the MDGs and what will succeed the MDGs, but there's a whole host of things taking place. And you may also want to think about what are the health dimensions of these upcoming meetings. So Beijing turns 20 as well, Beijing plus 20, the platform of action. They'll be having I think it's the 59th Commission on the Status of Women in March, and then a global leaders meeting in September. There's a conference on disaster risk reduction in March. You may want to think about the health aspects of that. The conference on financing for development, post-2015 in September, and then climate change in December. So in our campaign, we're also trying to think through how we can bring all of these different elements together. But those are also opportunities for you to feed in. So I think that's it for me.
Thanks very, very much, Fraser. That's a very comprehensive overview in 12 minutes and under, so very impressive. Thank you very, very much. Lots of things to chew on, and I'm sure a number of issues will come back for discussion during our question and answer period. So at this point, I'd like to hand it over to Sandeep to take it away. Sandeep's going to be talking on issues of sexual and reproductive health and gender.
Hi, folks. All right. I'm going to try using my camera and seeing if the bandwidth will hold up. I seem to be getting some warnings about bandwidth usage. So bear with me if this isn't working. I'll turn off the camera, and you'll just be stuck with my soothing sound of my voice. Well, thank you very much, first of all, to ICAD for hosting this webinar and for inviting me to speak at it. It's a great pleasure to do so. I'm going to spend probably 12 minutes or so talking about some of the processes that the UN has been engaged in to review the development frameworks. There'll be some overlap with what Fraser was talking about, but I think that overlap is helpful, and I'll get into more details for in terms of issues of concern for SRHR actors, including folks focused on HIV issues. So just before I start, just a quick word about the HLTF. Hopefully, at least some of you have heard of the Task Force for ICPD, which is an independent body of 26 leaders serving in their individual capacities, recognized for their various contributions in their field, including relating to sexual and reproductive health and rights. And it's the task force is focused on ensuring that SRHR, gender equality, and youth rights are embedded within the post-2015 frameworks, and that there's a linkage between the ICPD operational review and the post-2015 development agenda. A term of existence is until December 2015. First of all, one thing to bear in mind is that in the world of the UN, in terms of what the UN has been reviewing and is currently reviewing, the MDGs and the development of the post-2015 framework is one aspect, definitely. The development of the SDGs has been another aspect, but we can't also forget the two other processes that have been going on over the last little while. That's, of course, the review of the 20th year review of the Program of Action of the International Conference on Population and Development, which has now wrapped up, and the 20th anniversary of the Beijing Platform for Action, and the UN system has now begun those reviews that will be culminating, as Fraser mentioned, in at the CSW next spring. Now, one thing to bear in mind is that the MDG review, post-2015 process, and the SDG development processes really started off as separate streams. But fortunately, there was quite a bit of concern about the separation of those two streams. More or less, they've now merged into what's becoming a bit more of a simplified process from a rather complex one. Just to look at, first of all, because it's now completed, the ICPD review process, the first question you should ask yourselves is, what has that actually achieved? And the answer is that it's achieved a fair bit. First thing I'd mention is that in February, the Secretary General released the findings of the 20-year operational review, which is called the Framework of Actions for the follow-up to the Program of Action of the ICPD. And the report makes quite strong recommendations for advancing SRHR, reflecting the most progressive outcomes of some of the review processes during that entire ICPD plus 20 process. Of note in this document are the calls to realize sexual and reproductive health and rights of all people, including adolescents and youth, calls for comprehensive sexuality education, for SRH services and information for young people starting at age 10, elimination of all forms of violence against women, and critical services for survivors, including post-rape care, affordable access to modern contraception, including emergency contraception, removing legal barriers to safe abortion, including revising existing laws, and for governments to address violence and discrimination against people based on sexual orientation and gender identity. So despite the strong global review report in February, which really should be guiding future actions and follow-up to the program of action of the ICPD. Despite that strong report, the April 2014 session of the Commission on Population and Development did not really go beyond agreements made at the ICPD in 1994, and it is limited to calls for sexual and reproductive health and reproductive rights. So the sexual rights element that was absent in Cairo remained absent within that resolution. The resolution does take note of the Secretary General's global report, as well as various outcome documents of the regional conferences, which I'll talk about in just a second. Recognizing, of course, that the latter provide region-specific guidance on population and development beyond 2014, and that's quite important because the regional outcomes, as we'll see in a second, are actually quite good for the most part. The last stage of the process was just this past September, and that was the UN General Assembly special session on ICPD beyond 2014. And there was a fair bit of high-level recommitment to the ICPD agenda. I think there's been a fair bit of criticism around governments really showing limited understanding and commitment to the paradigm shift brought about by the Cairo Program of Action. But it also revealed that the ICPD implementation has been fragmented and only addressed in piecemeal fashion in national development plans and programs. So it's a bit of a denouement in what was a rather interesting and dynamic process. But some of the regional outcomes, as I mentioned before, were quite solid. I think in all but the review by the Economic and Social Commission for Western Asia, there were references to sexual and reproductive health and rights in full. In terms of adolescent SRHR, all referred to adolescent access to SRH info and services. Sexual orientation and gender identity specifically were referred to in the ECLAC and ESCAP regional outcomes. And ECLAC is the Latin American and Caribbean Economic Commission, and ESCAP is the Economic and Social Commission for Asia and the Pacific. Comprehensive sexuality education, all except ESCWA, contain references there. But the ESCWA one actually contained a reference to sexual education. Access to safe abortion was dealt with in a more mixed fashion. There was references to it where we're not against the law, which was agreed in all of the regional conferences except ESCWA. Consideration of amending abortion laws was agreed to in the ECLAC regional outcome, and review and repeal of laws that penalize women and girls who have undergone illegal abortions was agreed to within the ESCAP review as well. Eliminating and preventing all forms of gender-based violence in terms of recognition of critical services for all victims, survivors, and survivors of gender-based violence. That was agreed in all regional conferences, but two of them did not mention safe abortion as one of those critical services, and one also omitted emergency contraception in addition to that. In terms of prioritization of these issues, all regional outcomes called for making SRH services a priority within the health sector. So overall, very, very decent regional outcomes for the ICPD review. And of course, within the SDG process, taking stock of the accomplishments of the ICPD review is quite significant, not only because the final report of the Open Working Group makes reference to it, but also that will remain an important tool for the implementation of whatever framework is produced post-2015. Also, in some regions, there are follow-up processes to the ICPD review, such as in the Asia-Pacific region. So important for SRHR actors to bear in mind the outcome of the ICPD review. In terms of the SDG process, as Fraser was mentioning, we have the final report of the Open Working Group, and that's also being adopted by the General Assembly on September 10th by a resolution that welcomed the Open Working Group's report and reaffirmed it as, affirmed it as the main basis for integrating Sustainable Development Goals into the post-2015 development agenda, while recognizing that other inputs will also be considered. So the intergovernmental process to negotiate this in this new agenda was launched at the general debate of the 69th General Assembly on the 23rd of September under the theme delivering on and implementing a transformative post-2015 development agenda. Of course, as Fraser mentioned, we're waiting for the Secretary General's post-2015 synthesis report, which is anticipated by the end of this year, and it will be the main input for negotiations on the framework. But in terms of what the Open Working Group developed, the end result, as Fraser was mentioning, was 17 goals, 169 targets. It's quite a massive package. Under the health goal, there are targets to, by 2030, ensure universal access to SRH, sexual and reproductive health care services, including for family planning, information and education, and integration of reproductive health into national strategies and programs. There's a target to reduce global maternal mortality to 70 out of 100,000 live births, to end the AIDS epidemic and other communicable diseases, and also emphasis on research and development of vaccines and medicines, making full use of TRIPS flexibilities, which is quite significant. Under the goal, achieving gender equality and empowerment of all women and girls, it includes proposed targets to ensure universal access to sexual and reproductive health and reproductive rights, as agreed in accordance with the Program of Action of the ICPD and the Beijing Platform for Action, and the outcomes of their review conferences. So once again, this target itself has embedded some of the processes in terms of the ICPD process, which is review process, which has been completed, and the Beijing review process, which is currently underway. There is also emphasis in a couple of targets on ending all forms of discrimination, violence, and harmful practices against women and girls, including trafficking and sexual violence, and child marriage, and FGM as well. It sadly does not contain references to adolescents and no references to comprehensive sexuality education, although SRH information is there. SRH information and education is there under Goal 3, the health goal. Youth is very narrowly referred to within education and employment targets, and there's very limited content and accountability, and none on human rights-based implementation of these goals and targets. So just looking ahead, as we mentioned, the Secretary General's synthesis report is expected at the end of the year, and that will serve as the main input to the negotiations on the post-2015 framework. But in addition to considering some of these, the Open Working Group on SDG's final report, there are a number of other inputs that will be considered, such as the high-level panel report, the Sustainable Development Solutions Network report, various other inputs from the various post-2015 events and various global meetings that have been held, will all be part of the package that is considered in formulating that synthesis report. Of course, this will end, as Fraser's mentioned, at the 70th General Assembly post-2015 summit, and that it's expected that this summit will take place at the heads of state and government level. And prior to that, there will be a 2-day civil society hearing convened in July 2015. Right now, it's unclear what the appetite is for further negotiations. There's intelligence in New York seems to indicate that there is not much appetite to reopen the targets, the goals and targets that are being established within the final report of the Open Working Group. So that leaves the question of where are the main points of influence for SRHR actors, and a few streams are still under development and will be still under negotiation next year, and that includes financing, means of implementation, accountability, and the development of indicators. And these are all things that Fraser mentioned in his presentation, but I think they all are quite important issues for SRHR actors to be engaging on. The third International Conference on Financing for Development will take place in Addis Ababa in July at the highest political levels. And this will be as a follow-up to the agreements from the first two Financing for Development conferences in Monterey and Doha, and it will address financing the new development agenda. The zero draft for the eventual negotiated outcome is expected in February, and the reports of the Open Working Group, the International Committee of Experts on Financing for Development, and the SG Synthesis Report will all be input into the preparatory process for that conference. Informal and intergovernmental consultations will run until March 2015 in New York, along with informal hearings with civil society and the business sector. The co-facilitators of the conference and the outcome document are Guyana and Norway. In terms of the accountability framework, I think a key question to ask is not just the international accountability that will be present, and we already see the development of a high-level political forum, which was established as a political accountability mechanism for the SDGs. But we also have to be considering national level accountability and as part of the means of implementation of the SDGs, and particularly what processes and guidance will be given to states for actually implementing this robust agenda. And I would suggest that human rights-based accountability really should be front and center of that process, and that includes a robust view of accountability, not just focused on monitoring and evaluation, but also one that uses a variety of accountability mechanisms that are participatory, effective, and transparent, and also that make use of the international human rights system as well for accountability for these goals. I think within the SCAP outcome from the ICPD review process, we start to see suggestions of what the sort of steps that need to be taken or need to be reflected within a post-2015 framework in terms of the means of implementation. So the declaration actually calls on states to designate a national focal point agency to coordinate the full and effective implementation of that declaration at the national level. And it also calls upon states to empower communities to ensure the accountability of governments to ICPD implementation. And I think in terms of embodying the sort of identifying that responsible actor within government as the focal point, as well as putting an emphasis on participation and empowerment is quite critical, and that needs to be expanded on in terms of accountability guidance that's given to states within the post-2015 framework. I think the big worry that I would have is that accountability will be viewed purely in terms of monitoring and evaluation. I think it should be noted, of course, that that is important, but even for monitoring and evaluation, the human rights framework would have that done in a particular way, but there is a particular human rights-based approach to the development of indicators that needs to be considered.
Hi, Sandeep. Robin, just 2 more minutes, please.
Oh, yes. Sorry.
Sorry about that.
Yeah. No problem. Let me just wrap this up. So just on that, just to note that the UN Development Group is also holding a range of consultations, and you can find information about that online. It's including around monitoring, participation, and accountability. The ECOSOC AMR in July will be looking at the transition between the MDGs and the SDGs. As well, the high-level political forum will be replacing the ECOSOC AMR in 2016. And again, we'll touch on this later, but the Asian Plus 20 review process, again, a very key entry point. The regional commissions are currently conducting their review meetings, and this will culminate at the CSW in March. Okay, I'll stop there. Thank you. Sorry I went over time.
Thanks so much, Sandeep. That's will have definitely sparked questions in my mind, so I'm sure we'll have a very active question and answer period coming up. So with no further ado, I'd like to introduce Melissa Ditmore. Melissa, take it away.
Thank you. Thank you to ICAD for the opportunity, and I'm so pleased to be on this panel with Fraser and Sandeep, who, when I last worked with him, was not the ED. So I want to talk about the SDGs, the health goal, and HIV, leading into what we can do to influence indicators referring to HIV. However, all of these processes, aside from the ones that specifically refer to UNAIDS, will be applicable to other targets under, for example, Goal 5, which Sandeep talked about with a lot of the gender targets under the gender goal for Goal 5. Goal 3 was attain healthy lives for all. There are a number of sub-targets that echo the Millennium Development Goals, such as reduce maternal mortality, and I just skipped over the HIV goal. And the goal on HIV, target 3.3, and the epidemics of AIDS, TB, malaria, neglected tropical diseases, waterborne diseases, other communicable diseases. This had great wide support. Whether we'll actually get strong support in the implementation to address social drivers, including gender inequality, poverty, stigma, discrimination, and human rights-based indicators, that's what we're working for now. The only reference in the SDGs to what we call key affected populations if we work on HIV or most at-risk populations is in this target, referring to substance abuse as opposed to substance use, and including narcotic drug abuse and harmful use of alcohol. This is the only one that has any reference to what we would call key populations, and it's not all of the key populations. Target 3.7 refers to universal access to sexual and reproductive health care services, including for family planning. This was very, very controversial. However, you'll notice sexual rights is not included. Reproductive health care is not controversial the same way that sexual rights are. Considering this, I want to bring up, so wherever universal access is mentioned, universal is defined as 80% in these documents. So if we're not working on this to include language about the most vulnerable or indicators about the most vulnerable people, which could be sex workers, people who use drugs, low-caste people in India, and poor people everywhere, native populations, for example, the same 20% will still be excluded unless we get that in the indicators or in, for example, as Sandeep put it, rights-based indicators, human rights-based indicators. This is really important. Here we are with the universal health coverage, including financial risk protection. Again, universal is 80%. We really need to include the people that we couldn't get in a political negotiated document into the indicators, which aren't political or they are political, but they're not negotiated by the government unless they really take that on, and I can't imagine they could do it. modalities, which includes in part financing. So they refer to the Doha Declaration and TRIPS, which is really important, particularly as the U.S. is trying to push the Trans-Pacific Partnership with India, with China, well, not with China, but with India, and to erode TRIPS by attacking particular producers of generic drugs, primarily HIV, but we'll soon see it with hepatitis C drugs and really everything, new antibiotics, for example, if they're produced in Brazil and India, Thailand, China. These are the places that could actually work on producing generic drugs that we all want. The urgent actions encourage, if you have partners in other countries, please encourage them to participate in this. If your organization works internationally, or if you do any UN lobbying in blocks with other countries, please encourage them, as well as your own government in Canada, to advocate for civil society engagement. This has been a hard struggle every step of the way. The major groups, the women's major group, the NGO major group, the farm workers major group, every single step of the way we have to fight to have time to include anything. Encourage civil society access to all the meetings. This was a real issue during the open working group meetings, where they would say suddenly it's an informal, all you have to leave. And it makes it very hard to get information and documents about the intergovernmental process. Opportunities for civil society to submit written and oral contributions are really important, and opportunities for civil society to organize side events. If Canada would like to sponsor a side event in tandem with a country from the Global South about HIV during the next General Assembly in September, tell me. I would love to organize that. Let's see. Influencing indicators. What gets measured gets done. So we've talked about goals, and then there are targets under the goals, and then indicators are how what is measured. So indicators on, there are indicators for many things. The global AIDS reporting process includes indicators about how many sex workers were offered a condom in the last year or so. So indicators are an opportunity to include things that are not spelled out in the targets, like key populations, sexual and reproductive health and rights, and more. We need to reach UN statisticians, probably through working with UNAIDS, UNDP, and UNFPA. There are friendly people in all of these offices. There are people whose jobs it is to follow through on this. Eric Sawyer is the person at UNAIDS who is really the community civil society liaison. I'm going to post 2 links in the chat box to everyone. They are, so UNAIDS has released targets on eliminating stigma and preventing new HIV infections. The input for these is due this week. If you were part of the civil society working group, we would ask you for your input for us to collate tonight. Tonight? No, it's Monday. Tomorrow. Tomorrow close of business is when we would want that input to collate in order to put it all together to submit. But these links include the email address and the documents to comment on if you want to do that. And I surely hope you do. If you would like to have suggestions of what to include, I would be happy to offer you some of mine. Other things that are being called for, UNAIDS is calling for a 90-90-90 target. This means 90% of people at risk knowing their HIV status, 90% of those people getting access to care and treatment, and then this would reduce 90-90-90, what's the third 90? I think that's access to treatment, and then 90% of those people being virally suppressed, so that you would have a 73% reduction in new infections. This is a goal for 2020. This is not a goal for 2030. This is very ambitious. How they'll do it without, well, with good human rights practices, I'm not sure, and that's why we have to put a lot of pressure on them. That's one reason. Let's see. Sandeep had a great list of other upcoming events. Mine is incomplete. Thank you. I'm sorry to have rushed through, but I live in New York and we talk fast. Thank you.
Thanks so much, Melissa. Wonderful presentations, everybody. Thank you very much. I'm going to open up the floor to questions and answers. I know I have a couple up my sleeve as well, but I'd love to hear from you. So again, to unmute your lines, please use *6, or feel free to ask your question in the chat box, which is in your lower right-hand corner, and I'd be happy to voice that on your behalf. So I'm going to open up the floor for questions and answers. Okay, maybe I'll kick it off here. I think one of the common threads that I've heard throughout the 3 presentations is around a human rights approach. And the first thing that, well, it's one of the first things anyways that comes to my mind when I hear of the data revolution. It's something that's being picked up by a number of international agencies and multilateral organizations, this need to know our epidemic, this need to know what we're working with. I guess my question comes down to, in terms of developing indicators, when we're talking about sexual and reproductive health and rights, and when we're talking about HIV, and when we're talking about gender and vulnerable populations and key at-risk populations, data can often mean, persecution and flared stigma and discrimination. So although a lot of these processes and these indicators are still very much in process, are there ways in which civil society organizations can get involved in these groups to ensure that there aren't human rights abuses that go along with this data revolution? So I open that up to all of our panelists. Who would like to take the first stab at that? Sandeep, Melissa? Fraser?
Well, I can chime in, and this will allow Sandeep and Melissa to have a more intelligent response. From the data perspective, I guess maybe what you're getting at is it's an opportunity, at least the way it's being framed, to, in my mind, to further disaggregate some of these issues, so that you can disaggregate by gender or disaggregate by age, by different type of group, etc. So that would be an opportunity for you to identify groups that are missing and potentially, I guess, identify potential violations in terms of everyone not having universal access to healthcare if there's a certain group that isn't benefiting. But I guess the challenge with that is, data is a technical thing. They only want to develop things to measure. And from my experience, and maybe it's different in the health sector, but you need to have a mix of qualitative and quantitative indicators, and it's the qualitative indicators that are really going to give you a bit more texture in terms of actual violations, I would think. So I don't know if I've really responded to your question, but that's what comes to mind.
I think, if I could add to what Fraser's saying, and I think Fraser's given a very good answer, I would add that, first of all, if you are taking a human rights approach to data and to indicators, it's exactly that. Disaggregation is important, and being able to track the exclusion that individuals are facing based on key grounds of non-discrimination, key grounds of inequalities and non-discrimination. It's really quite key to be able to track that. But as Fraser was saying, it's not just the quantitative indicators. Even in the health sector, qualitative indicators are important. And tracking structural indicators and process indicators from a human rights perspective, in addition to outcome indicators, is also quite important as well, and can't be forgotten. You know that the right to health requires that all health services, facilities, and goods comply with the AAAQ framework, the accessibility, availability, acceptability, and quality. And that when you think about data and you think about indicators from the human rights perspective with respect to the right to health, there really needs to be indicators and measurement of all of those points, not just availability or accessibility, but also issues of quality. Quality of care is central to human rights and the right to health. So that's quite critical as well.
Thanks,
I would
Sandeep.
like to echo everything Sandeep and Fraser have said, particularly that qualitative indicators are important. In the Data Revolution report, which came out on Wednesday, they have one reference to data aggregation, which I'm sure AIDS activists were not the only people who suggested this, but certainly perhaps the most numerous group. We're pleased with that, but we're also a little worried about the Data Revolution report because it doesn't seem to pay enough attention to qualitative indicators, and I'm not as pleased with the overall attention to structural drivers as I would like, and some of that is qualitative and hard to measure by people who want to use data.
No, absolutely agree.
I might add one sort of final thought, and I'm not an indicator guy, but the extent to which you can, and there could be some pushback on this, I'm just thinking of strategy, but the extent to which you can make some of those human rights indicators seem more like a technical exercise, i.e. Sort of use indicators as a backdoor to get in some monitoring and evaluation of human rights things or through a human rights lens. That might be one opportunity. So include stuff as indicators that you want to demonstrate where there could be potential violations.
And just wondering whether or not in any of the dialogues that have happened there's been any discussion about establishing kind of a watchdog or an arm's length organization to help oversee the national implementation of these goals. Just, I mean, I completely agree, you know, the data segregation is really very important in order to shape programming, but it's also, you know, can be incredibly dangerous to people who are already highly marginalized and at risk, as we all well know. We put a poll up to inquire about the regions in which folks on the line work. I think we're still gathering results, but please feel free to share a little bit about your work, and there will be one more poll that will be coming up shortly. Are there any questions at this point for our three panelists? Please feel free to either write it in the chat box down below or to raise your hand, and to unmute, it's *6. Okay. Well, I have another question here for Fraser in particular, just thinking about things that are going on here in Canada in particular. I'm wondering, in terms of the intergovernmental negotiations, given Canada is made up of a number of different jurisdictions, a lot of these discussions won't necessarily sit at the national level. Will also involve municipal and region or provincial jurisdictions and ministries. So as we're looking forward and thinking about how we can use the information that we've gained today and to continue doing our research and our discussions, who should we be approaching at the local level to start these discussions within our local constituencies?
That's a good question, and maybe you guys can give me a good answer. I'm not entirely sure, because in conversations with DFAT-D, so our our Foreign Affairs, Trade and Development, they're very conscious of the fact that, just as you've mentioned, they don't have jurisdiction over a lot of the issues that they're negotiating over. So they're conscious that they need to engage the provinces in a consultation on this, and provinces and territories, but haven't yet done so. So, I mean, this could be an opportunity for you to play a role linking federal government officials with their respective counterparts at the provincial or territorial level. But I'm not really sure how they're going to do it, and it's a huge, I wouldn't say oversight, but given that negotiations are starting in January, I'm quite surprised that this has been on their agenda for a good year and they still haven't done that outreach.
Yeah, absolutely. Absolutely. So that is something that we will definitely follow up on, and would love to work together with everyone who's on the call with us today on that.
And just maybe to say as well that for me, this is the thing that I'm most excited about. And this is sort of the take that I think CCIC has on this process, that we see the whole process in New York is interesting, but it's very difficult, I think, to engage on it and influence it, because there's 190 plus governments, there's a whole host of CSOs. We're trying to influence what we can through Beyond 2015, which I think is sort of a key stakeholder. But us trying to influence one government who in turn then has to negotiate with another 190, I don't think we have much opportunity for influence. Where I think the interesting thing is more at the domestic level, connecting with groups that work on health issues, that work on HIV/AIDS, that are maybe facing the same challenges that groups everywhere around the world are facing. And I think it's a real opportunity for building solidarity and, connecting on this issue of universality and solidarity on these issues, because Canadians will be able to see themselves ideally much more in a post-2015 framework than they ever did.
Yeah, absolutely agree. All right, we have two questions here. One from Ashley from World Renew. Her question is for Fraser. Can you tell us a little bit about CCIC's post-2015 campaign launching in the new year?
Yeah, so this we're still putting together. We're a little bit behind on it just because we've been quite stretched. But we want to essentially make foreign policy and in particular international development a little bit more of a federal election issue. And I know everybody says that foreign policy is never going to determine whether or not you vote for one party or another. And there's always debates about the extent to which you can even get it on the agenda. But I think we're increasingly thinking that this will be a big issue on the agenda. Stephen Harper has sort of given some early indications that he wants to put it there. The Conservatives have, I guess from their perspective, a good global image in terms of promoting MNCH. They're world leaders at G20 meetings, at G8. They have the experience. They're trying to shape an international position for themselves much more than they have in any previous elections. And I think we want to encourage the Liberals, the NDP, the Green Party, etc., to be clear on what they want from Canadian foreign policy looking forward. There's some things that the Conservatives have done and a lot of things that they haven't done. And we think there's an opportunity for creating some space in particular to talk about what Canada looking forward is going to do on women's rights and gender equality, on human rights and inequality, and on sustainable development and climate change. As I mentioned, there's key opportunities coming up through the coming year, and we're hoping we'll be doing at least 2 big events. We have our Leaders Forum in February during the International Development Week, in which we're going to be launching our new narrative toolkit and organizing some days on the Hill with the presidents and CEOs of member organizations to talk about the the campaign that we're launching. And then in May, we'll have our annual forum, which is focused on universal goals, Canadian challenges. And again, we want to be talking about those issues. And I can provide you with a PowerPoint with a little bit more detail, but we've just hired someone who's going to try and put together some of these thoughts into a little bit of an action plan. But it's an opportunity. It goes far beyond just the international development sector. If you imagine something around Better Canada, Better World, or Better World, Better Canada, we see this as an opportunity for environmental organizations, labor groups, health groups, international development organizations, anti-poverty organizations to let Canada know what you want from future Canadian foreign policy.
Thanks, Fraser. Really great points, and look forward to sharing that PowerPoint presentation and keeping in touch with you about that. Melissa has also written here in the chat box and provided a link to ways in which we can keep in touch with Canadians in the ground in New York, working at the mission in New York. One way to also, she mentions, is to call and ask who the person responsible for the post-2015 framework is within our local jurisdictions. So thanks very much for that, Melissa. We also have from Maria Jose a question: are there thoughts or proposals for what one qualitative indicator on sexual rights should be? So I'll open that up to the panel.
There are lots of really urgent things. The first one that comes to mind for me would be comprehensive sexuality education for youth. And coming from the U.S., I would really want to specify that it be fact-based, which is not an issue in Canada, perhaps, but it is an issue in lots of the world, including my country. I say this simply because youth has not been paid enough attention to with regard to sexual health and sexual and reproductive health and rights in the SDGs, but there are so many that could be there.
Mm-hmm.
Yeah, I would tend to agree with Melissa that there are a number that could be there in response to Maria Jose's question. I think also issues of, well, just simply legal and policy framework within a country and how that then impacts on specific outcomes or the realization of specific targets. I think that within the sexual rights sphere is quite critical to also bring into the discussions.
Thanks, Sandeep. Thanks, Melissa. Any questions, comments? Okay, it's a lot of information to sift through. I do understand that. One of the interesting things I think on the horizon and has been touched on by all of our speakers today is the issue around financing. Now, I'm not overly familiar with the report that was released, but I'd be interested in hearing a little bit more whether or not there are efforts in place to help coordinate donors, knowing that this is a replenishment year. And next year also will be a replenishment year for many of our big organizations like Gavi, the Global Fund, what some of the thoughts or discussions have been in New York around that area or around that issue.
This is actually something that I need to get a bit more up to speed on, but I think the first meeting at the intergovernmental level on FFD is tomorrow. So the Committee of Experts has produced its report, but those discussions are just getting underway. So I'm sorry I can't be more useful on that, but just maybe one consideration, it's a little bit depressing, but to throw out there is last week I finished looking at the aid numbers for Canada, and I appreciate that not everyone from on the call is a Canadian organization, but while overall aid from OECD donor countries actually bounced back and increased in 2014 and hit its highest amount ever. It will be important for that to continue. So that was for 2013. It will be important for that to continue that trend in 2014. And as I mentioned, that will be a really important signal, I think. Those results will come out in April of where global aid stands or OECD aid figures stand in April. So that will be important to see ahead of this July Financing for Development conference. Canadian aid has really plummeted. Maybe some of you had seen that the decline in, I think 2014 was, 2013 was 14%, or no, sorry, 11.4%. And the figures that I've looked at since the 2012 budget, the Canadian aid allocations have decreased by 620 million, which is a staggering figure. We're far below even what the budget indicated we should be, approximately 300 million below what we were supposed to be, according to budget 2012. And I still have to check this, but it also seems, as with 2012-13, in 2013-14, there was a huge chunk of money that was returned to Canadian Treasury. So it's not for want of programs. It's the government purposefully underspending on things. And while we welcome the recent announcement of funding for the Maternal Newborn Child Health Initiative, looking forward, if this trend continues, it's going to increasingly crowd out funding for a lot of things. So going ahead to 2015, Canada has a really abysmal record.
Absolutely. Lots of opportunity to advocate and to try to get our messages across. Any further questions for our panelists? Okay. Well, please feel free to communicate with us. You all have our email address. If you have any follow-up questions, we would be happy to pass them on to our speakers. We have just included a link to our evaluation survey and kindly ask that you take just a couple of minutes to share your thoughts with us about today's session, future sessions, and topics that you might be interested in participating in related to this issue and otherwise. Another piece is that we will be developing an information sheet synthesizing the presentations and the materials that we've discussed today, and that will be circulated shortly within the next month to 6 weeks. So we look forward to keeping in close touch with everyone. A huge thank you to all of our speakers with us today, to Fraser, Sandeep, and to Melissa. Wonderful insights, a lot of information, and we look forward to continuing our discussions and to continuing our conversations. So thanks to everyone who's joined us, and again, thank you to our speakers. Take care.